Like sands through the hourglass, so are the days of our lives. And here is another enema. You know where the coffee's going. It is flowing. Now, there's amazing things that happen when you do an enema, and I'll go into that some other point. This is a tag along from day 2, trip 50. I wonder how many more enemas I've got left until I die. Could be thousands, could be less. It depends on how well these treatments work and how well my liver works. But it's a gravity-fed enema, and I've got to hold it now because it's about to fall off. And this is a cool enema. I'll put some ice in it, probably a little bit too much ice. So I'm having a slightly thermogenic effect in my large intestine, and you can work that out for yourselves. I'll probably get a few chills, but on the bright side, when you cause a decrease in your body temperature, it burns off glucose to warm it up. So if you're into the ketogenic diet, like there's a tube going down. Oops, you know where it's going, I won't show you that. Here though is something exciting that I will show you, and it's not what you're thinking. This is the wound from yesterday's TACE operation, where they cut my femoral artery and injected chemo directly into the liver. So I'm protecting my precious bone marrow where my immune cells come from. And that is really, really, really important. So another enema is away, and I will relax and meditate and pray. And I wish the bulge in the pants was something worth getting excited about, but it's just my wound repair. But here's something exciting. Here's my peritoneal port, so that we've injected some viruses yesterday, the day before yesterday, into the peritoneal cavity, and they're tagging all of the tumour cells and making them visible to the immune system. They're also what we call repolarizing the micro tumour environments. That's the intention. Now, there's no guarantees. No one can really tell you. And up here you can see my chemo port that had viruses put into it yesterday and the day before. Again, here's my fantastic dendritic cell vaccine. I love kissing that vaccine spot. Those cells are really what's going to save my life. So at the moment, they're releasing some chemokines that attract other dendritic cells to the skin, and they share their information, a bit like the generals who have seen the intelligence of what my tumour looks like, what its exact chemical and physiological structure is at a level that dendritic cells can understand. And we call them tumour antigens. Now they're being transmitted through my body as we speak. Now it takes about 7 days for the message to get to the tumour and the lymph nodes. Now, I shouldn't be telling you this, but in the past, when I've had a lot more cells in my dendritic cell vaccines, I've had the opportunity to inject them directly into the sites of tumours. A highly experimental but scientifically based approach. But I didn't do that yesterday because there wasn't enough. So even yesterday's very expensive set of therapies was not at a level which would have been optimum. Now this is because I didn't probably have enough tumour cell, I didn't have enough immature monocytes on store at ICE in our magnificent laboratory. So I do need to get that fixed for the next vaccine, which I hope will be in 2 weeks or 4 weeks. Given the urgency of my situation, I hope it's 2 weeks. This is really going to showcase the absolute best case dendritic cell response you've ever seen, that I've ever seen, that the world's ever seen. I'm going to go from 20 active tumours down to a clear liver as fast as possible and prove without doubt that this medicine is ready for prime time. I shouldn't be the luckiest cancer patient on the planet. We all should be the luckiest cancer patients on the planet. Now, this is going to be politically incorrect, but I'm forecasting a massive flow of funds away from big pharma into cellular therapies. This should have happened 4 years ago. It's happening now. And the next step is not just dendritic cell therapies, which we make in laboratories, which keeps us alive, but we can make these cellular responses endogenously within ourselves. Now that's what my foundation is experimenting on in me, and that's why I'm seeking your financial support for the Trayhurn Immunological Foundation, dedicated to what we call endogenous dendritic cell therapy techniques. This is a branch of immunotherapy that I'm pioneering, which we call metabolic interventional immunotherapy. There's a tremendous scientific basis for this, but there's no robust clinical implementations. The entire world is obsessed with making trillions of dollars from the dying, and we're missing the greatest opportunities that are a fraction of the cost. So that's my story for today. Another enema, it's sitting inside me, doing no harm. And this is where, in my case, you will see something funny. I'm going to show you how you move your stomach. And you can turn on your side, and you can work your colon, and you can get the coffee flowing. Most importantly, I'm increasing the blood supply to my liver. Now you might want to ask me why. Well, if you don't, you die. Now the portal blood supply is a very complicated system. In a nutshell, I've got to clean my filter. It's got to be oxygenated. It's got to have the right nutrients. Now these are all contributions where holistic health can come in and help us. But that's not enough on its own, and it never has been and it never will be if you've got active cancer cells in liver tissue. So to all of my alternative friends, you get 10 out of 10 for trying, but most of you are dying if you've got stage 4 liver cancer, like me. Now if it's done in your liver, then I'd say you're really lucky. I've got cancer bloody everywhere. So, but the liver is the number one target to get cleared up, because that's where you die from. And that's what we treated yesterday. That was Professor V's main clinical focus. Having a healthy liver and doing this coffee enema might actually be depleting a few of the chemo cells, some of the chemo agents that may be residing in the liver. But I don't really care about that. Very much the nature of our concept is that we go in and we just have to cause a little bit of fire on the rim of these tumours, and that's happened. To keep the other cells happy, to keep my gallbladder functioning, to keep the pancreas functioning, to have robust physiological health while undergoing these aggressive treatments seems paradoxical, but they actually very synergistic. And the key component that everyone misses out on is the liver does so many functions, especially the thing called CDC and ADCC, where we make our antibodies. Okay, now B cells make the antibodies, but some of them come directly from the liver too, the complement factors. These are all important for our overall health. So the immunotherapy that my foundation will bring to the world is based on merging experimental therapies, alternative therapies, and conventional therapies. I can offer consulting advice about my experience. I'm only a dying cancer patient after all. I think I can still talk to you and do these YouTubes without any real conflict of interest. I can motivate the dying to try interesting therapy approaches that are scientifically based and that have worked in me. Now, who else can say that? No one on the planet has tried more experimental therapies than me. And that's why I don't want to die. My message is simply too important to lose. And it's probably time to get some help, some serious help, financial help, scientific help. So these videos are my way of reaching out. You can see how long the coffee's been in there. I have no complaints. I have no pain. And if you can see the way you can move all of your abdominal organs. Now this comes from Qigong, an amazing practice. I can move my pancreas, my spleen, my liver, my kidneys. You actually can connect to every organ in your body that you need functioning. You will not live, you will not be healthy if all of your organs are not working well. In another area I will teach you or share with you, you just work it out for yourself. You have to be able to engage with your lungs, and that's where yoga and yoga breathing are essential. You can do Qigong and engage with all of your deeper internal organs. You actually can talk to your organs. You can physically, mentally connect to them. You can fix the problems where they exist to some extent. You need some drug support, some therapies as well. You need everything you can get your hands on to enhance your quality and quantity of life. The only problem with Big Pharma is the big lie that you can't do all these other therapies that can help you. I'd be dead without Big Pharma, so I'm grateful to their research, their support, and I understand they have to price their drugs. But the medicine I'm interested in, my foundation is interested in, is offering the most advanced immunotherapies to the poorest and dying people on the planet. So Big Pharma can have their